Very, very good, very good afternoon. Very good afternoon, everyone. So, uh, depression and homeopathy, rather, homeopathy for depression. Depression or mental illness as a whole, there is a lot of stigma and taboo in our society, even in today's date. A progressive society, a modern society, a civilized society should not have any stigma associated with any mental disease. So it is one of the greatest ironies of date that there is a stigma associated, there is a taboo associated with mental with mental diseases. Uh, Recently, the 2020 Cricket World Cup came to an end on 14th of November. Uh, this year, in this World Cup, even the ICC highlighted the issue of the taboo and stigma associated with mental diseases. So I was really glad that uh, they picked up this topic. First of all, there is still a lot of stigma and taboo associated with mental diseases. Secondly, uh, I chose depression because depression is the most common of all uh, psychiatric illnesses, perhaps more common than anxiety disorders, and obviously much more common than schizophrenia and personality disorders. So that is why I chose depression. And one more thing that you might have noticed, if you are a doctor, for a common man, any psychiatric disease by in general is termed as depression. He misnomer he a common man, he or she uses depression as a misnomer for any psychiatric illness for that matter. So first of all, the stigma that is associated with that needs to be abolished. The stigma needs to be abolished, and we need to understand what depression is in order to treat it. So before understanding depression or before understanding mental health, we'll try to understand uh, before trying to understand mental illness, before trying to understand depression, we should try to understand what mental health is. If you try to understand the WHO definition of mental health, so mental health is a state in which a person recognizes his or her abilities, can cope up with the normal stresses of life, and thus can contribute to the society. Mental health is not just absence of disease. Mental health has a lot to do with the way people uh, think, feel, and behave. Mental health, as the definition says, in a state of mental health, the person recognizes his or her abilities, is able to cope up with the normal stresses of life. For example, if we see what are the normal stresses of life, for example, we get a deadline. The students get a deadline to finish the assignment and project by a certain date. Working people get a deadline to finish a particular project. So the deadline, uh, we need to finish it by the deadline. If the deadline is preponed, then you need to like change some plans. So if for a housewife, the maid is on leave for 15 days, and particularly if the maid is on leave for 15 days and the house and she's a working lady, so these are the normal stresses of life. Just few examples of normal stresses of life. A mentally healthy person is able to cope with these normal stresses of life. A mentally ill person is not able to cope with these normal stresses of life. Mental health has a lot to do with the way people think, the way people feel, and the way people behave. Making it very simple, uh, you should be able to feel, think, and behave according to the situation. For example, if one is supposed to attend a funeral, he should be able to feel in uh, in connection with the funeral. Like, you should know the gravity of the situation. For example, if there is a sad occurrence in the family, you should be able to feel sad. In a happy occasion, one should be able to feel happy. Even negative emotions such as anger, it is we should be able to cope with the anger, but there are moments which cause justifiable anger. So जो जिस सिचुएशन में जो इमोशन फील होनी चाहिए, द इमोशन दैट शुड बी फेल्ट, दैट मस्ट बी फेल्ट इन अ पर्टिकुलर सिचुएशन, इफ दैट इज फेल्ट, we say that the person is mentally healthy. If the person is thinking rationally, logically, in reasonably, if a person is overthinking without any justifiable cause, the person is not mentally healthy. If a person is thinking very less, he's least bothered about the things around him, he's indifferent, the person is mentally unhealthy. If the person is not behaving properly according to the situation, the person may be unhealthy. So, this is the WHO definition of mental health and the simple interpretation of it. A mentally healthy person is able to cope up with the day-to-day stresses. A mentally ill person is not able to cope up with stresses. There are certain ways in which you can boost your mental health, or in which you can maintain your mental health. I think we'll see that later. Now coming to depression. Depression is the most common of all psychiatric illnesses, and depression is relatively easier to manage as compared to other psychiatric illnesses like personality disorders or schizophrenia. Depression is very, very common, just as I said. That is why I thought of covering this topic. So what depression is? So depression needs to be differentiated with grief or bereavement and sadness. So there are some positive emotions, there are some negative emotions. Joy, happiness, motivation, love, affection. These are positive emotions. Anger, hatred, guilt, jealousy, sadness. These are negative emotions. But if you feel sad on the death of your grandparents, this is a negative emotion, yet it is a healthy emotion. Just as in accordance to the definition of mental health. If you are feeling sad in a sad situation and happy in a happy situation, you are mentally healthy. Right? Though sadness at the death of your grandparents is a negative emotion, but yet it is a healthy emotion. Depression, on the other hand, it is an unhealthy negative emotion. So the difference between depression, grief, bereavement, we'll consider it, but we'll see what depression is. So, if you see the diagnostic criteria for depression, if you are having these symptoms or any 5 of the below symptoms at least for 2 weeks, then we can say the person is depressed, or we may diagnose that as clinical depression or major depressive disorder. The symptoms of depression can be easily remembered by the acronym SIGE, SIGE, CAPS, CAPS. So S for sadness and sleep disturbances, I for interest loss of interest in daily activities, or loss of interest in such activities which used to give you happiness and pleasure earlier. Loss of interest and loss of happiness. A depressed person will not be very jolly on seeing a stand-up comedy act. So sadness, sleep disturbances, loss of interest and loss of happiness, guilt, energy levels are low, concentration difficulties are there, the appetite is disturbed, the appetite is low, psychomotor agitation like signs of nervousness, anxiety and depression, purposeless physical activity, for example like biting the nails, which is more prominent of anxiety, but it can be there in depression also. So Signs of uh, purposeless physical activity, for example, repeating a task again and again and again, purposeless physical activity, purposeless activity, psychomotor agitation, and suicidal thoughts. So if a person has any five of these, at least for a period of 2 weeks, you may diagnose it as clinical depression or major depressive disorder. Now, depression needs to be differentiated with sadness. Sadness, it is if there is a death of loved one, if you come across some failure in life, maybe some failure in examination, some business loss, or uh, some relationship issue, a breakup or a divorce. So it's very normal and usual for someone to feel sad. But if sadness is, on the contrary, presented just as I said in the way above, if it is depression, then it is unhealthy. Sadness and depression can coexist, but we still can differentiate. A sad person can feel happy when a happy occasion or an happy event occurs. A happy event can nullify the sadness or lessen the intensity of sadness, whereas a depressed person may not essentially feel so. In depression, there is low self esteem, guilt, uh, uh, pessimism, which is not associated with sadness. The suicidal thinking, uh, which is typically associated with depression, may not and is not often associated with sadness. Sad, though, and if you are sad because of death of your grandfather or father or grandmother of your sibling, uncle, aunt, in periods of your sadness you can have the happy memories. The happy memories sometimes can uh, lessen the intensity of your sadness, which is not the case in that of depression. So this is the difference between sadness and depression. And depression is associated with low self-esteem, a feeling of guilt, a feeling of and tendency to have negative outlook towards the things. So we saw what mental health is, the general considerations about depression, what depression is, how can you diagnose depression. The Now, what are the causes of depression? The causes of depression can be internal or external. Internal in the sense, depression can be hereditary. There can be certain biological factors, biochemical factors rather, hormonal factors, low levels of serotonin, norepinephrine, or and dopamine. Low levels of these hormones and neurotransmitters can lead to low moods and depression. Depression can be genetic. Certain personality types in which there is low self-esteem, guilt, pessimistic thinking. Such personalities are more prone to depression. Depression can be a result of a constant stress at your personal life or at your professional level, and all those events that cause sadness can cause depression. For example, failure in student life, or failure in the professional life, or failure at the relationship level, whether it is a breakup or it's a divorce, that can lead to depression. Or uh, unhealthy relationships, poor socioeconomic conditions, poverty, poverty, constant stresses, prolonged stresses. Uh, but anything which makes you unhappy can land up into depression. For example, if you're not happy with the job, you can be sad and you can be depressed. If you're not happy with any relationship, if you're married, if you're not happy with your spouse, that can lend you depression. Unhealthy relations for a prolonged period of time, some clashes, some differences of opinion, some unresolved conflicts with your parents, with your like spouse, can lead to depression. So since we have seen what depression is, the diagnosis, the diagnostic criteria of depression, the causes of depression, so the treatment of depression is, as far as modern medicine is concerned, the treatment of depression is medication. Then we have psychotherapies, which is talk therapy, rational emotive behavior therapy, uh, cognitive behavior therapy, dialectical behavior therapy, and if depression is associated with psychotic features, particularly, or if depression doesn't yield to all the other means, then one may need to take help of electroconvulsive therapy. So, are let's some people are live. I think some people are with us. So, any questions regarding depression till now? So, anyone wants to have a one-to-one discussion regarding depression or anything, like? Else, I'll continue what I wish to speak. Anyone wants to have one-to-one conversation? Else, I can. So, are you having? Was it beneficial till now? So you can just. I'm not able to see any comments. Okay. So before entering into the role of homeopathy for depression, we'll just see how to have a healthy mental health. To have a healthy mental health, all the rules that are essential for a healthy physical health are applicable for having a sound mental health. Regular moderate exercise, at least 150 minutes a week, proper hydration, 1 liter behind every 20 kg of body weight, balanced diet, because like serotonin, is related to essential amino acid tryptophan. If there is certain deficiency in diet, that also can lead to depression. So diet also is related to depression. So a balanced nutritious diet, regular moderate exercise, at least 150 minutes a week as directed by WHO, proper hydration, sound sleep. Sound sleep is very, very essential. It has been observed that if the medication is proper, if the other auxiliary measures are being implemented properly, but a person is not receiving sound sleep, it may make a lot of difference in the outcome. But if proper sleep, sound sleep is achieved, that will certainly make a lot of difference. One secret of mental health which I have discovered these days is digital detox. For few hours a day and for few hours a week, abstain from all the social media, because there are many positive things happening on the social media also, but social media has made social media has brought its other drawbacks also along with it. A lot of things behind which there is a lot of propaganda and there is a lot of agenda, something against the ruling party, something against the opposite party, something which is detrimental to the feeling of national integration, something which is detrimental to the feelings of communal harmony, something about this community, something about that community, and such sort of content is lot of propagated on the social media. So if you can just abstain for certain hours, so you stop entering all those, stop all those rubbish entering your mind for certain for certain hours at least. And a simple thing, which I'll tell you an acronym, which which is which is very you might find it intriguing and like beneficial for the maintenance and enhancement of mental health. Remember the acronym UPS. UPS stands for uninterrupted power supply. Certain places have it for their electrical requirements, electrical settings. Uninterrupted power supply. So I have just changed it to UPS, unconditional self acceptance. So if you're in a if we all know that people are like fascinated by beauty, success, the X factor. If a person is not having such things, he or may not feel loved or accepted. So unconditional self acceptance, psychological needs of safety, security, self esteem, need of affection, the need to be needed by someone, self actualization, all these psychological needs, the fulfillment of these psychological needs is absolutely essential for a sound mental health. And S is for socializing. Man is a social animal. It is seen that prolonged period of isolation or having a bad social life, having a less social circle can lead to depression and other psychiatric illnesses. At least it can aggravate other psychiatric illnesses. So, social man is a social animal, hence socializing is so essential. S also stands for stress management. Stress management can be done by exercise, relaxation techniques such as deep breathing, yoga, pranayam, uh, pursuing your hobbies. So UPS, uninterrupted power supply. UPS also stands for unconditional self-acceptance, psychological needs such as safety, security, self-esteem, need for affection, need to be needed by someone, self-actualization. And S stands for stress management and socialization. And one more acronym which you need to understand and implement for a very sound mental health is I am Pearl. I stands for keep improving yourself. M for manage your time. P for be positive always. E for learn to manage your emotions. We should be able to control our emotions. Generally, what happens now? Emotions control us. So, in a very ideal state, we should be able to control our emotions. So, I am Pearl. I keep improving yourself. M manage your time. P be positive always. Just as I said that negativity and pessimism is a predisposition to developing depression. So, be positive always. Learn to manage your emotions rather than you control your emotions rather than being in a state where your emotions control you. Avoid unnecessary anxieties and worries. Resolve all the conflicts. Hatred, anger, and the bitterness is not good for mental health. And learn to laugh, learn to love, and learn to live. Oh, I forgot. There's a quote I forgot who said that. We do not laugh because we are happy. Rather, we become happy when we laugh. So these are the tips for having a sound mental health. And now coming to the role of homeopathy. Most importantly, homeopathy can be taken along conventional medicines, conventional modern medicines. And when the person begins responding very well to homeopathy, the dose can be tapered, not by the homeopathic physician. The psychiatrist may himself or herself feel the necessity to taper the doses. Homeopathy can be given along with modern medicine, along with psychotropic drugs, along with antidepressants. As we know, homeopathy is very individualistic, holistic. As you know that homeopathy treats the person in disease rather than the disease itself. So homeopathy considers a very holistic and a comprehensive approach to the disease where not only the person, the situation, the circumstances, and not just the situation, how the person behaves in that situation, how the person behaves in a healthy state, how the person behaves in an unhealthy state, how the person reacts to the situation. All those things are taken into consideration, which renders homeopathy very, very individualistic and very, very comprehensive and holistic. First important thing that you need to be noted is homeopathy can be given along conventional medicines, and when a perceptible, a noticeable response to homeopathic medicines is observed, the psychiatrist may taper the drugs. There is, if homeopaths are listening, there is a pattern to continue. If you are trying to, putting it using a 50 millisimial scale would be much better than centesimal scale. But if you are for some reason or the other, if you are like persistent with centesimal scale, uh, one good plan of treatment would be to ensure that at least for 6 months or 1 year, or for at least 6 months, there will not be change in the uh, treatment plan as far as the modern medicine is concerned. And then you can give a single dose of the 200 potency of the indicated medicine, and now you can give daily doses of 12 C potency, as long as there is perceptible improvement, and then you can make the changes when some improvement is noticed. So this is the scope of homeopathy. Just as I said that, like, depression can be managed in a better way as compared to other psychiatric disorders, and it can be managed wonderfully with homeopathy. So this is all what I need to say. So if there are any questions from the audience, or else I'll end my talk. So thank you so much. Thank you so much for joining and listening. I hope it was beneficial.